I'm Liz Coates. I'm Head of Research Governance. I work down at the Horton site near Salisbury in the Research Support and Governance Office. I don't have a team, it's just me. So that's nice and straightforward if you need to know anything about research governance. I'm the person that you would need to come to.
Clear line of sight, all the
Okay, yeah, next one. Okay, it's very important because there are an awful lot of regulations around confidentiality, data protection, depending on whether you're doing research or whether you're doing other public health practice types of studies. It's very important to make sure that you categorise your study correctly, or you can end up having to go through an awful lot of regulatory hoops that you may not absolutely need to for research. I only deal with research, so that's what I'm going to concentrate on today. This is a very useful table which will allow you to get a really good idea about what your activity is and how you would classify it. But of course, if you can't decide, and sometimes it's difficult, there are a lot of grey areas, you can always come to me and I can help you to work out exactly what it is you're doing. There is a link to this table at the end of the presentation. There's a number of links on my useful link slide, so you'll be able to get to everything that I'm showing you today. This was actually developed by the NHS, this particular one. Okay, next one. Okay, using data and research. So, a great deal of the research that's done in PHE does involve NHS patients, their tissues, and all their data. Most research of this type will require an NHS research ethics review. This service is administered by the Health Research Authority, or the HRA. You can have either a proportionate review or a full review. This is very dependent upon the kind of study that you're actually running, and if there are any material ethical issues in the work that you're doing. If there aren't any, then you can go for a proportionate review, which is more straightforward than a full review. You have to complete the IRAS form, which is the Integrated Research Application System. This is a horrible form. Nobody likes it. Has anyone ever done one? I think, yeah. They're horrible, aren't they? Lots of duplication of information, drives you nuts. They have been talking about rejigging the whole thing, reformatting it and making it much better. They've been talking about that for some time. I think we're going to be stuck with it for the time being. Again, I'm there to help. If you get stuck, give me a ring or send me an email and I'll do my best to help get you through it. When you fill in your IRAS, there is quite a lot of the form is actually about confidentiality of the participants, where you're going to keep their information, who's going to have access to that information, how long you're going to keep it for. So you must make sure that you've got all of this clear in your mind, that you know exactly the answers to these questions when you're completing this form. It's very important that you get these things right. You need to be compliant with the Data Protection Act and the Research Governance Framework. Again, if you need any information on those, by all means, give me a shout and I'll help if I can. Okay, next one, I think. This is the proportionate review. This has been introduced recently for getting your study up and running in the NHS, your research study going. If your study falls into these criteria, you can have a nice, quick, expedited review if you have no material ethical issues. It takes 14 days for you to get your response come back from the committee, so it's very fast. You don't have to turn up for a meeting. It's just enough. It's all done by email. It's all electronic, nice and straightforward. So, obviously, it's got to be anonymous to the researcher. Or you need to have consent for research. If you're part of the clinical care team, you can actually use identifiable patient data, but you have to make sure there be no breach of confidentiality. So it's different rules if you're part of the care team. If you're actually accessing the data as the care team and you are anonymising it, before before it actually is given to the researcher to use as part of their study, then that is also fine. But you can't have access to identifiable data unless you're part of the care team without going for a full NHS ethics review. Again, if you've got full consent from the patients, then that means you can go for proportionate review. There's no material ethical issue there. Right, so next one please. Okay. This is the NHS full ethical review. So if your study doesn't fall into any of those previous categories, you're going to have to go for the full review. It's going to take a lot longer, and although you don't absolutely have to go along to the meeting, it's much better if you do actually go. So you're going to have to set aside an afternoon to turn up at the meeting and ask questions. It's not that bad actually. They're very, very nice, the ethics committees, but you know, it's just extra hassle and it's extra time. You will also need as well, you will also need the permission of the confidentiality advisory group as well if you're actually accessing confidential patient information and you're not part of the care team. This is also true if you're accessing identifiable data collected for a different purpose. So if you've collected identifiable data for surveillance purposes, for example, and you've decided you want to use this data for research, you will need to get approval from the confidentiality advisory group. The good news is it's not a separate application. It goes off at the same time as you're submitting for your NHS ethical review. So it's all the same electronic form and it's quite straightforward to do it. But, as I say, it might take you longer, so you'd have to build that into your timelines when you're planning your research study. Right, in these cases you do not need an ethical review by the NHS Research Ethics Committee. So you've got non-identifiable data, information, which has been collected as part of normal care, can be used for research, but it has to be completely non-identifiable. And this is also true of research undertaken by staff in the care team. This research would require review by the PHE Research Ethics and Governance Group, because all research that's undertaken in PHE needs to come through the PHE Research Ethics and Governance Group, or REG, as we call it. And I'm just going to give you a little bit of an overview of what REG does.
Chaired by the Craig Prince, is it?
Certainly not. We've got a very nice chair, actually. He's independent, he's external, and he's very experienced, so he's excellent. We've got a number of lay members. We've got representation from the HRA, which administers the NHS grants, and we've got a membership across PHE. Lots of experience, lots of expertise there. Not only they look at independent review of all research, but they also have been known to look at research that's been sponsored by external organisations to PHE. Some local authorities, for example, run research studies. They don't have an ethics committee that they can take it to, and they have brought it to PHE in the past, and we've given them an opinion. It's a virtual group, so it's very quick. It means you don't have to wait for a formal meeting. So you submit your application and it's sent round. It takes about 2 weeks. The applications come to me. So this is really just an oversight of the PHE Ethics and Governance Group. Been going for about 2 years now. Okay, next one please. Okay, as I've already said, any PHE-led research must come to the REG. But it's also, REG reviews also require for service evaluations that interface with service users and require access to identifiable data or tissue samples and involve sensitive topics or vulnerable participants. That's also true of any